And thank you very much. We are in process of our COVID-19 ongoing emergency, and we will ask for a COVID-19 update from the county manager. Thank you.
Good morning, Madam Chair. I'll start with Kathy Hedin, Ramsey County Public Health Director.
Thank you, Deputy County Manager Berg, and thank you, Madam Chair and Commissioners. Here is the current COVID situation update in Minnesota and Ramsey County. And Control Room, we will navigate over to the website so we can show the data dashboard. In Minnesota, right now, the positivity rate is 5.8%. With 56,560 people who have tested positive for COVID-19 to date. Total cases requiring hospitalization is 5,298, with total hospitalized in the ICU 1,545. Hospitalized as of yesterday in Minnesota is 302. And in the ICU, as of yesterday, is 153. Both numbers are continuing to go up, and we continue to watch those as they are important to pay attention to. Unfortunately, 1,656 people have died from COVID to date, with 1,231 of those people in our long-term care facilities. We'll go over to the Ramsey County data. The positivity rate currently in Ramsey County is 7.9%, so a couple points above the state of Minnesota. We currently have 7,044 people who have tested positive to date in Ramsey County. Total cases that have required hospitalization in our county is 894, with 276 in the ICU, and unfortunately we have lost 264 people to COVID-19. We'll go down to the racial and ethnic demographics. Of the 7,044 cases, or people, 33% are white, 22% Asian, 21% Black, 13% unknown, 10% other, and 2% multiracial, with 34 cases now within the American Indian community. The 16% of the cases are represented by people who select Hispanic. Total approximate number of completed tests in our state to date is 1,070,925. We continue to have many test kits available to perform tests, which is good. Remember, you can get this information from our data dashboard by going to www.ramseycounty.us/coronavirus. I have two updates for you today on testing and schools, and we've navigated over to our testing page, which you can find on our coronavirus web page if you go to the link. We have, beginning this Wednesday, Saturday, August 8th, beginning this weekend, Saturday, August 8th, and Sunday, August 9th, and continuing for all weekends, the month of August, St. Paul Ramsey County Public Health will be partnering with Ramsey County Parks and Recreation, Ramsey County Medical Reserve Corps, Karen Organization of Minnesota, Hmong American Partnership, Hmong Healthcare Professionals Coalition, mHealth Fairview, St. Paul Public Schools, and Minnesota Department of Health to offer COVID-19 testing at two sites. Community can get a test on Saturdays, August 8th, 15th, 22nd, and 29th from 2 to 6 p.m. at Aldrich Arena, which is at 1850 White Bear Avenue in Maplewood, and on Sundays, August 9th, 16th, 23rd, and 30th, also from 2 to 6 p.m. at Washington Technology Magnet School, which is at 1495 Rice Street in St. Paul. COVID-19 testing is open to everyone. It is free and no insurance will be needed. You can get tested whether you have symptoms or no symptoms. Both sites will accommodate vehicle drive-through or walk-up, and there will be interpreters available on site. The community outreach team is working to promote these events within communities, and the Medical Reserve Corps team will be providing volunteers to be on site each weekend. In addition to COVID testing, there will be an education resource table. Karen Organization of Minnesota and Hmong American Partnership will provide on-site MNsure navigators, and there will be people available to provide information about what happens to someone if they have a positive result, and information about what to anticipate with contact tracing. Registration is recommended, but it is not required, and a registration link will be provided soon. We'll have promotional flyers available in English, Spanish, Hmong, Karen, Somali, Oromo. And we, again, welcome anybody and everybody to get to these testing sites, as they are very important to help slow the spread of COVID. Thank you to Christine for navigating through our dashboard and our website this morning. The other big news that came out since we last met was Governor Walz, Education Commissioner Ricker, and Health Commissioner Malcolm provided the School Safe Learning Plan through Executive Order 2082. The plan outlines 3 learning models that schools can choose from based on a 14-day case rate of each county across the state. The learning models are for in-person learning, a hybrid of in-person and distance learning, and then fully distance learning. To figure out the case rate per county, you take the number of COVID-19 cases over the last 14 days, and you divide that number by the county population per 10,000 people. The last case rate recorded for Ramsey County was 16.51. In comparison, Hennepin County is at 20.93, Scott County 20.99, Dakota County 16.79, and Washington County is at 14.84. All metro counties appear to be trending upward. In order for schools to be able to consider in-person learning for all students, they must have a case rate between 0 and less than 10. For elementary in-person and middle and high school having a hybrid model, the rate must be between 10 and less than 20. And for both of those groups at a hybrid model, the case rate must be between 20 and 30. For elementary hybrid and middle high school distance learning, the case rate must be between 30 and less than 50, and then all distance learning has to occur when the rate is 50 or more. There's been a significant study across the world that shows elementary age students up to 6th grade have limited transmission ability of COVID-19, which is why they have the ability to stay in school in person over a longer case rate or a higher case rate than the other age groups. The older students get, the older that students get, the more ability they have to spread COVID-19. A team of staff consisting of an epidemiologist, a nurse, health educator, emergency management staff, and in addition to myself and Deputy Public Health Incident Commander Laura Anderson and Medical Director Lynn Ogawa, will be meeting with our superintendents of each of the school districts within Ramsey County tomorrow to listen to their questions and needs. There will be a regional support team staffed by Minnesota Department of Health and supported by us within local public health, who will work alongside our school districts to ensure that they have the information and data that they need to be able to make informed decisions. To say that the plans will be complicated is likely an understatement. While decisions will need to begin with a baseline of the county case rate, there are many other influential data points that will help school districts decipher. For example, there may be an increase in cases because of an outbreak in a workplace or another isolated situation. If epidemiologists can determine through contact tracing that the increase in cases is due to controlled or an isolated outbreak, schools may not need to change their learning models to reflect the new case rate. There are mechanisms also in place to both dial back the plans or dial them forward, and there will also be options for testing teachers and students if there are 50 or more cases that are connected within a school. As we get closer to the start of the school year, we will have more information to provide you about our school start plans. Thanks for your time today. I'll turn it back over to Deputy County Manager Berg.
Thank you, Director Hedin. Questions for Kathy Hedin?
Thank you. I am having a little difficulty seeing my participant list, but I do have 2 hands up. And so I will call on Commissioner Mary Jo McGuire first and then Commissioner Crescent.
Thank you, Madam Chair. I appreciate that. And thank you, Director Hadeen, for your continuing ongoing reports. We appreciate so much all of your work. I have a question about the testing sites that we're going to be doing in August, and I really appreciate that. I'm glad, and we don't know what will happen after August, so people shouldn't expect that we will continue to do testing regularly like that, but at least for August in preparation for school, that would be the case, right? People do we have any idea if we're going to continue that after August? Do you know?
Madam Chair, Commissioner McGuire, my expectation is that we will continue providing testing sites. They will be moved around based on the case data that we are receiving and the positive tests that we receive. So the location and communities that they're in right now are based on the data that we have. We are, while we are setting these up for this weekend, we are already planning for sites that are specific for Latinx community. So it's kind of a two-pronged process. As we have sites that are up and running, we have a team of people who are planning for the next sites. So we plan to be doing this as long as we have to. We know that there are gaps in testing in many different places for many of our community, and we want to provide no barrier testing for as many people as possible who need it. So the sites that I provided you just now for the weekends in August are just the first 4 that we are doing. There will be more.
Thank you. Thank you so much for that. I really appreciate that. And another question is, you said there'll be information tables at the sites, which I'm excited about. I think it's great that we provide information. And at those sites, I can't remember if you said if there would be, maybe lists of where people can get food. And I'm also wondering if we're going to be providing voting information. We are, a county that really wants to get as many people voting early, in absentee and registered. And so I'm just wondering if that kind of information would be at those tables as well. I'm just thinking that every time we have a county function like this, that we would be hopefully providing information on other county services.
Mm-hmm.
Madam Chair and Commissioner McGuire, I think that's a fantastic idea, and we'll ensure that there are tables and opportunities to promote all of our food sites and all the other work that's happening right now through our CARES work, as well as any resources that we feel, based on community feedback, are needed. So I appreciate that you brought that up.
Thank you so much.
Thank you very much. I think the next question was coming from Commissioner Fretham.
Thank you, Chair Carter. Public Health Director Hadeen, I have 2 questions. The first one, I think, is a shorter question, and that is whether there are any plans for proactive random monitoring of schools for outbreaks, knowing that COVID can present asymptomatically. And with your comment that we do have testing available, is there any intent to proactively monitor some of our schools to see if there is spread happening before we detect it in an outbreak form?
Madam Chair, Commissioner Fretham, I truly appreciate the question, and I wish I could say yes. At this point, within the plans that I have read through, it actually explicitly says that there are no plans to do surveillance testing within schools. Unfortunately, while we have tests in the state, we don't have access to enough tests to be able to do that. And so that is unfortunate, but we will continue to monitor through symptoms, through contact tracing and case investigation, and we'll do our best to get through that process.
Great. And then my second question, which is I think probably a bigger question and potentially one you can't answer, is how we as parents should be interpreting the availability of the distance learning option, knowing that statewide the outbreak of COVID really varies, in that our leaders were having to navigate the understanding and the complexity of families not having childcare options, the differences in transmission that you referenced for younger children versus older children, the realities of some children maybe not having safe places outside of school, not having, some families not being able to support the academic achievement of their children in the home, access to food and other resources, children with special needs who need those in-person supports that schools can offer, and just the stark reality of disparities between people's home environments. We know that some children, there are benefits to being in school socially, but those benefits in a socially distanced classroom aren't necessarily really going to be there for other kids. So as parents, how do we make those decisions when we know that there's a distance learning option? Should those of us who think we can manage that distance learning, even if the hybrid or in-person option is available to us, should we be taking the option and removing our children as potential disease vectors from the classroom? Or should we be taking the fact that hybrid and in-person is available to us and sending our kids to school? That's a big question, I'm sorry. Public Health Director Hadid, but not all of us parents have a Public Health Director at our table to ask this question to.
Right. Madam Chair, Commissioner Fretham, I just want to wave a magic wand to help fix all of that. As a parent with kids in public school, those are the same things that go through my mind. I think having this meeting with our superintendents and staying closely connected with them to help them understand the data and help them understand how spread happens, and really help, to the best of our abilities to ease their concerns about decisions that they need, very tough decisions that they need to make, will be very important. This COVID is still new. It just, we're a few months in still, and getting our education systems enough time to figure out how to manage this is hard and difficult, and it's going to be tough for the next year of school for everyone. I have all the resources in the world at my fingertips, and I find it challenging. So I can't imagine, for those who have children with special needs and whose kids need to be fed. These are really important things that you bring up, and we're going to have to take it a bit day by day to figure out what's going to work best for all of our families. I appreciate the questions and comments. Thank you.
And thank you very much for the questions. Also to Kathy for your assistance to help us understand the variety of issues that are swirling around as we manage at this point the COVID-19 outbreak, and also as we manage the opportunity for schools to think about the levels at which reopening will happen, and to manage in those plans as we dial forward, dial backward as may be necessary at some point. We appreciate that our public health department is involved in helping them understand the data and information about how we can keep our children and our families safe. That is, after all, what is most important. There is a lot of decision making to be done by the districts, by our parents, by all of us. I appreciate the difficulty, and thank you, Commissioner Fretham, for that question regarding schools opening and how parents ought to be able to make those decisions. So much is going to be based on individual circumstances as well. Before we leave our questioning, I do see that Commissioner Reinhardt has raised her hand.
Thank you. I have a question about, I know that there was a call for folks that have had COVID-19 to come forward. They're looking for plasma and to have them help out. Do we play any role in trying to contact people, or is it just something that they read in the paper or hear about?
Madam Chair, Commissioner Reinhardt, I'll have to get more information about that. We typically have not played a role in helping in that process. Sometimes it's a part of a study through a health system or a university system. So I'll have to get more information to see what the ask is, to see if there is a role for us as a local public health department. Thanks for bringing that up.
So once again, thank you very much for this update. I know that you will be meeting with the superintendents, that you'll be staying in close touch and providing assistance they move through, and all of us move through this decision point. I want to just check once again. I'm looking to see if there are any additional questions. Commissioner McGuire?
Thank you, Madam Chair. I actually have a question for Assistant County Manager Berg. If she hasn't finished, if she's going to do another report, I'll ask it afterwards. But I do have a question that I think is more geared at the Assistant County Manager.
All right, then I will just check in with Kathy Heding in case you have final wrap-up comments from the public health perspective, and we'll go to Deputy County Manager Berg as we close out the COVID-19 update.
Madam Chair, sorry, no further comments about COVID. We'll get back to you next week with more updates. Thank you.
Thank you very much for being here with us. And Deputy County Manager Berg will return to you to close out of the report and questions.
Thank you, Madam Chair, and thank you to Director Hedin. I do have two other COVID-related updates. The first, I want to highlight yesterday's launch of 6 community career labs at libraries across Ramsey County, including Dayton's Bluff, Rice Street, Rondo Community Library, and Sunray locations of the St. Paul Libraries, and Ramsey County Library, Maplewood, and Roseville location. These career labs will provide reservation-based computer access, printing, copying, digital literacy programs, and job search and resume assistance and other workforce supports through the end of the year. They're a great resource for our residents, and I particularly want to thank you, Chair Carter, for speaking at yesterday's media event, along with Mayor Carter, St. Paul City Councilperson, and St. Paul Library Board Chair Jane Prince, and Catherine Penkert, the director of the St. Paul Libraries. It was a great event, and I want to thank and highlight the work of Workforce Solutions, folks throughout the incident command structure, property management, information services, and our communication team for all the work that went into this launch. Second update I have for you is elections. We know that the pandemic is driving a very different way in the county residents voting, and I have updated statistics for you this week. As of yesterday, we had just over 86,000 ballots sent out, and 35,262 ballots accepted for an overall return rate of 41.4%. As a point of reference, the number of ballots accepted exceeds the total turnout of the August 2016 state primary. Yesterday, the Ramsey County Elections Office set an internal record for the largest number of ballots opened and counted ever in one day. 61 staff counted just over 18,000 ballots. In-person voting continues to be slow. We're averaging 25 people a day, which is about a third of the in-person turnout we saw for the presidential nomination primary back in March. And I also want to highlight that all of our in-person absentee voting locations, Plato Building, Roseville Library, and the New Brighton Community Center, are locations where voters can drop off their voted absentee ballot without getting out of your car. Our staff will greet them at the vehicle and take custody of their absentee ballots. We are ramping up our staffing to ensure that we are able to count all of the ballots by the end of the day on August 13th, 2 days after primary day on August 11th. Ballots need to be postmarked by the 11th and must be received by the end of business on the 13th, and statewide results will be available later that evening. Encourage residents who have decided for whom they are going to vote to go ahead and get that ballot in the mail to us or drop it off at one of those sites as soon as they can. And I also want to highlight that we do have live our absentee voting dashboard on the Ramsey County Open Data Portal. The dashboard provides real-time, daily updated information on the number of ballots sent and received, and breakdowns by both Ramsey County City and Precinct. And so that information is available and, as I say, is updated every day. Those are my updates, Madam Chair.
Thank you very, very much. That is incredible. We really appreciate the great work that has been done getting the information out and increasing the turnout, in particular in mail ballots. Knowing that those sites can take this information as drive up, drop off, or can take the ballots that way is also incredibly encouraging. And we just want to make certain that we continue to help. I know if people are mailing in their ballots, the news is reporting that today's a good day to do that, to make sure to do it by today, with concerns for what may be happening with the Postal Service and making certain that we get those ballots in time. Thanks for doing all you are doing to ensure that we have great turnout. I want to call on Commissioner Ortega and then Commissioner McGuire and then Commissioner Ortega.
Thank you, Madam Chair, and thank you, County Manager Berg. That is great information. So I have a couple of questions. First on, just congratulations on the career labs, and just to confirm, and for the viewing public, those are not walk-up career labs. Those are, you have to sign up ahead of time to go into those career labs. Those are for computer use. That's still going to be a sign up prior to coming in. You can't just walk in for those. Is that correct?
Madam Chair, Commissioner McGuire, that is correct. It's a reservation-based system.
Okay, thank you so much. I just wanted people to be not surprised when they come and want to use some of those resources that they needed to sign up. Also on the voting, it's great that people can drop off their absentee ballots and have someone or meet them, or they'll be there to take those. But they can also go in person to those 3 sites, right? So there's actually, you can walk in and vote in person at the Plato New Brighton Community Center and Library in Roseville. Is that correct? That's also in person? Just be clarified.
I'm just looking it up, Commissioner, to make sure that I do not misstate. That is correct.
Okay, thank you. I just want to make sure that it's great that we're providing as much access as possible for people that want to exercise their very important right to vote. So thank you for that. And then I have another question, and I'm not sure if this is something we can answer now, but I just want to put it on our radar in that I'd met with Keystone Community Services, who are doing such an amazing job with food, with trying to feed our residents that need food, and so they're looking at they need to expand into another building, and so they need some infrastructure dollars. And are our CARE dollars available to help people with infrastructure when it's for food stability or housing? I can't remember if any of our CARES dollars, and I didn't know the answer when we were having our conversation, and I was just curious, and I said I would bring it up because we know that we are very concerned about making sure that people have access to food and shelter, and if any of these dollars can be used for either of those things.
Madam Chair, Commissioner McGuire, we have a process within the incident command structure for assessing whether individual requests are CARES eligible or not. So I'd encourage you, if you want to send me the details, I'm glad to have follow up with you on it.
Thank you for that. I appreciate that. I just said I would mention it at our board meeting, and so I appreciate that. I will definitely follow up with that. Thank you.
Thank you very much. I do recall that as we were releasing those dollars, we did have dollars dedicated to the financial assistance and services that are typically provided that people can qualify for. And so I do look forward to getting the more detailed information back. Would encourage that we will see a positive response in that regard.
And I appreciate that, Madam Chair. And it was just and we know that it's for the services are pretty much covered. It was just for infrastructure. It's for actually buildings. So we're just not sure. And that's something we might have to do some more research on. But yeah, but people are having needs in all of those areas. And so, of course, that's why we need a bonding bill. But anyway, okay, thank you.
Right, thank you. I'm sorry, I didn't hear that completely. Commissioner Ortega.
Thank you, Madam Chair. I was going to ask a similar question. Could Joanna repeat where people could vote in person? I think with the mail-in, a lot of folks are confused of where they could go and vote. And there's still quite a few, more than half of the folks I've run into want to go vote in person.
Absolutely. Individuals may vote in person at the New Brighton Community Center, at Ramsey County Library, Roseville, and at the Ramsey County Election Office at 90 West Plato in St. Paul. On ramseycounty.us, there's information about hours as well as maps to those locations.
Thank you, Joanne.
Thank you very much. And that is for early voting, is that correct? County Manager, or I'm sorry, Deputy County Manager Berg. That is for the early voting?
Madam Chair, that is correct. That's through Monday, August 10th.
And on the 11th, of course, those voting locations, as per usual, are open.
That is correct.
Thank you very much. I'm looking and I do not see additional hands raised. I'll ask a final question. If anyone has a question at this point to direct to Deputy County Manager Berg. Thank you, Commissioner Reinhardt.
On election day, I mean, obviously we've got, X's and circles and things on the floor for people for social distancing. The mandate, of course, is in place because it would be in a public space for a mask. Are we going to have masks available then for folks that come in? And how are we planning to make sure that that is enforced?
Thank you.
Madam Chair, Commissioner Reinhardt, I don't know the answer to having masks available at those sites. I will ask Deputy County Manager Karen Francois and her team to follow up with the board on that question.
Thank you for that excellent and insightful question. Appreciate it. And thank you for the response coming forward. Commissioner McGuire.
I have another question now that I just saw Commissioner Reinhardt's census voting T-shirt in the background, which I love, that you keep reminding people about that. But I also just heard on the news that there was going to be an extension, but now there's not going to be an extension. Are we affected by that? Or, I mean, at some point I would like to get a sort of an update on the census and how we're reaching out to people, because I think they were thinking that they didn't want to be door knocking people's homes anymore due to the pandemic, and so they were not going to be increasing the time frame for taking the census. I don't know if Commissioner Reinhardt has any update on that, or how we're doing with counting people that haven't sent in their survey yet.
We'll check first with Commissioner Berg and for any comments from Commissioner Reinhardt afterward. I'm sorry, Deputy County Manager Berg.
Thank you, Commissioner. First, I have a real-time update from Deputy County Karen Francois, who advises me, yes, there will be masks available at voting sites. And secondly, Commissioner McGuire, I don't have answers with me on the census, but we will get an update to the board yet this week.
And thank you for that. And if it's needed for this week, or we could have it at our next board meeting on Tuesday as well. I'm happy to have it unless it's imminent that we need to know that information. But thank you.
And Commissioner Reinhardt, I'll turn to you for any additional comments.
Yes. I mean, earlier this year, it was extended to the end of October. And yes, right now is the time when we are about to do some of the door-to-door things. And I am not sure, and I would need to get more information from Jolie Wood and Clever Benton with the City of St. Paul. In fact, we're going to have a meeting, thinking it's tonight, of the Complete Count Committee within the next couple of days, I know, to get an update again. I might as well give the update as far as the percentage. We are at 75.7% in Ramsey County. And so, in Minnesota, of course, is still number one across the country. But we are doing very well in getting the self-reporting done. But it has, I mean, clearly this has changed how we do the census, but trying to make sure that we can reach out, especially to underrepresented, traditionally underrepresented communities, which are basically mostly communities of color, and trying to make sure that we get everyone counted. That is so critical, as we all know, for so many different reasons. But the Census Bureau, and I know that, again, Jolie and Claire would be able to give us more information on exactly what the timeline is up for each phase of what we are doing. But I do know that at least pretty early on, they extended the time for it to be done, but it does have to be done this year, clearly. So we will see what happens. And moving forward, I know that they have been staffing up, but there are other ways to reach out to people rather than just knocking on doors, because that has become more and more problematic, obviously. So that helps a little bit. It's something that we would have had to have done by this time, obviously, in previous decades.
Thank you for that. And I just say I'm happy to have a report at the next board meeting, so we don't need to have that any earlier than that. But thank you.
Thank you very much, and we will look forward to an update again at our next board meeting. Thank you to Deputy County Manager Byrd for carrying that forward for us. I'll turn back to you, Deputy County Manager.
That concludes my remarks, Madam Chair. Thank you.
Thank you so very much once again for our COVID-19 update.